All right. Welcome, welcome, everyone, to our mighty group for members helping members. My name is Tiffany Yvonne Cox. I'm part of Unite for Strength, as well as Nina and Kevin here. And I had a conversation with our colleagues where we just wanted to get into conversations with members of SAG-AFTRA and look at different ways that we can support each other when it comes to the different things that come up. Obviously, there was a huge change that happened within our health plan recently, but there's also resources that we've discovered or are rediscovering that definitely come into play to support us during these times, which is covered California, which is our topic for today. So, just some things to note for this evening. This is being recorded, where we will possibly be placing it up on YouTube so that our members can have this as a resource. We are not experts here, but we do have some tips and tricks just from possibly exploring and educating ourselves all the way to even going through the plan. Again, I reiterate, we are not experts, and we're also relying on you guys too that are here today to share your tips and tricks. Because, like we said, this is members helping members. And when we all come together, we're able to move forward, hopefully in a really a positive and strong way in order to have healthcare for ourselves and for our families. Right. So for this evening, like I said, it's being recorded. So note that for number one. Number two, the chat is disabled. But if you have a question or if you have a tip or trick, please raise your hand. If you click on participants, that bar that's down below, you'll see your name and you can click raise hand. You'll see a blue hand come up, and Ellen will unclick your hand in order to be able to share your comment or to share your question that you can ask to us live. Okay, so that's how we're going to do it for here today in this Zoom. So I would love to go ahead and introduce these lovely folks that I have right next to me right now. Can I start off with Nina? Nina, can you introduce yourself?
Hey guys, Nina Shmoshko here. I've been a SAG member since 1985, long time, and I'm grateful to be here and share my experience with Covered California, which I've been using now for, I don't know, since its inception, actually, since its inception. So I'm happy to be here and be of service.
Thank you, Nina. Kevin.
Hey, everybody. My name is Kevin Ashworth. I'm a Los Angeles-based actor, and I currently serve on the Commercial Performers Committee in SAG-AFTRA, and I've been involved for several years. Recently also ran for the annual convention. That's been over a year now. And I am happy to share a little bit about Covered California tonight. Thanks, guys.
And like I noted before, my name is Tiffany Yvonne Cox. I am an LA local board member, first year ever doing this, and also on the Women's Committee and on the National Next Gen Committee. I had covered California many, many moons ago, about 5.5 years ago. So I came back to this information now when I became interested into how to support our members when it comes to this. And once again, I reiterate, we are not experts, but we have taken the time to either have gone through it or to look up things to hopefully share in some knowledge. So I just wanted to highlight a couple of things. The deadline's coming up, December 15th. December 15th is the deadline to sign up for Covered California, and that will provide you with coverage for starting on January 1st. So it's really important that if you are about to lose coverage and you need coverage for 2021, you must sign up by December 15th. There are some exceptions that are listed on the website. Nina or Kevin, if you guys have any other additional information, please pop in with it. But that's one of the most important dates, December 15th for coverage on the 1st. Kevin.
Tiffany, I just wanted to, say you just said, hey, there's additional information on the website. So to clarify, because there's probably multiple websites we're going to be talking about tonight.
Great. And I'm going to put this website in the chat for everyone, which is the Covered California website. Really simple, coveredca.com. Right there. So that's where you can go. And it is actually quite user friendly in order to go through and get yourself coverage and see what the different options are. Okay, great. And as well, a tip for new enrollees, you can get help on demand. So instead of sitting there and like waiting for somebody to pick up or going through all the different functions, you can, when you go onto that website, there is something that literally says, and this is only for new enrollees. You couldn't have done this before, new enrollees, and you can get help on demand by calling, leaving your number, and they'll get back to you within 20 minutes. So a great way to save some time for yourself. Okay. So let's pop into some of the questions that I have. A difficult question asked on Covered California is, what is your total household income for the year? We are all artists. We know it varies year to year. Hello, hashtag 2020. How have you guys answered that as artists, Nina?
Your previous tax return. That's all you need to do is find out what you earned in the previous year, and then you'll know if you qualify for it or not. And everything's listed on the website, so you can figure out, like, if you're a family of one, if you're a family of two, if you're a family of three, what your earnings need to be, where you need to be in order to qualify.
Great. Thank you.
And there is, opportunity. There are subsidies available and different options available for people with lower incomes. So typically, if your income is up to 600% of the federal poverty level, then it may qualify you for some of those discounts or subsidies.
Great, great. Which segues me right into the difference between Covered California and Medi-Cal. Nina? I'll just unmute.
Sorry, I feel like I'm on a game show. Raising my hand, like, I got it. I got it. The difference between Covered California and Medi-Cal is Medi-Cal offers low cost and free health coverage to eligible residents, California residents with limited income. And Covered California is the state's health insurance marketplace, where Californians can shop for health plans and access financial assistance if they qualify for it. So it's not only like a market, it's like it's an exchange almost, and it helps you figure out where you can go, and you can also play with, say you do have a little bit of pocket money, you have some pocket money that you would like to put towards your insurance. You can change whatever plan you can maybe get for a more platinum plan or a gold plan, or you can use just what, that's what you can do there, is you can play and look at and see where you would like to sort of file yourself into, which insurance program you would like to have. So hopefully that answers that.
And I can give more dollar amounts. So if you have limited income up to 138% of the federal poverty level, you'll probably be eligible for Medi-Cal. For a single person, that's $17,609. For a family of four, that's $36,156. Income above that, you probably won't be eligible for Medi-Cal, but between that and the 600% of federal poverty level, you'll probably be eligible for the federal tax credit, California state subsidy. There's also for American Indians and Alaska Natives, there's a zero cost program due to some long treaty long ago that's really great. And there may be some other options for young people or older people, but so Medi-Cal is only for $17,600 and below for a single individual.
And interesting fact, because we live in Cali. So you're like, how is anybody living off of 17K in California? So a little bit of history, this has not been changed since the 1960s. Hence why these numbers are what they are, though they make no sense.
Love that you know that, Tiffany, by the way. I just have to say, I love that you know that statistic. You're a rock star that you know that statistic. I too have delved deep into this because I was like, why is this? Why is this number so low? Anyway.
Right. Well, and I can't take all the claim of just being a nerd and looking up stuff, which I have done. But I will say that there is a really cool thing that the Actors Fund has offered. And Kevin, do you want to possibly take on and talk about that? Where I received some of this information by taking a couple of, I watched two of them just for myself, preparing for today and remembering what I've gone through, covered California with every artist insured. Do you want to talk about your experience, Kevin, when you've gone through it?
Yeah, I've gone through it more than once. The Every Artist Insured program is something that they do. They have a California specific version. The Actors Fund also does one from New York. There may be other versions beyond New York and California. But what they do is they present you all the information. They talk about copays, deductibles, out-of-pocket maximum, et cetera, et cetera. You get to meet at least one or maybe more people who work at the Actors Fund as a healthcare specialist. I'm going to share some of the charts and stuff that they have. The Actors Fund has prepared a lot of material that I don't have access to, or I certainly don't have the right to disseminate. Is this a good time to share the charts, Tiffany, or should we just talk about it?
Yeah, share it. I think that's cool. You've already gone into it. Yeah.
Okay. So on Covered California, coveredca.com, there is a chart that lists all the various options, and I'm going to try to do a screen share here. One moment while I work on that. Da, 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 da. Okay, now this is kind of an in-depth chart. I find it a little bit daunting. So we're going to, right after this, I'm going to share a condensed version of this. But this is how they show you all the options. On the left, minimum coverage. That only pertains if you're like 30 and under. Bronze, silver, gold, platinum are sort of the levels of these plans. Bronze has lower premiums. Platinum has rather high premiums, monthly premiums. And then the enhanced silver versions, those are only available if you qualify for a subsidy. Otherwise, you would just get silver. So because there's so many options there, well, first of all, you also take a moment to look at the rows, right? You know, if you go to a primary care visit, you see there's a copay of $65. If you're on the bronze plan, copay of $40 on the silver plan, etc. And you can go down the list and see that there's some breakouts of some of the costs. So at the very bottom is a very important number, the annual out-of-pocket, annual out-of-pocket maximum. Except for the subsidized ones in the middle, very different. So essentially between bronze and platinum, you have this ability to choose, and it might be overwhelming, but it's also an option for you to say, do I need much coverage in the coming year? No, I'll do bronze. Do I have procedures or prescriptions or something coming up in the next year? Yes, then I'm going to do gold, or maybe even platinum if you're going to splurge, or silver. So this chart is available on coveredca.com. I'm going to share a link to it somehow in a moment. But for now, I'm going to share with you a reduced version of this chart that I found to be helpful. And when I say I found it to be helpful, I should actually say that I made it. I just reduced information and made a simpler chart. That did not seem to work. Hold on. One more attempt. Is that working?
Yes, it is.
Am I showing a new chart?
Yes.
Okay, my screen is showing me something that you're not seeing. So one moment here. Oh, shoot. Okay, so you can see the reduced chart now, yes?
Yeah.
Okay, great. So I've just reduced it to bronze, silver, gold, platinum. If you qualify for a subsidy, if you're under 30, you probably want the full chart. But this is just a good way to see what they're offering. So your exact monthly premium will depend on your age and other factors. So we don't have the exact dollar amounts, but if you sign up for a bronze plan, you're going to pay a monthly premium about $300 a month-ish. And so you're going to pay more as a copay when you're going for a primary care visit. And you're going to pay more for a lab test, and you're going to pay more for generic drugs, $18. If you get gold, you're going to pay less for all of those things, but you're going to pay a higher monthly premium along the way. And as you can see at the very bottom, $8,200 is the annual out-of-pocket maximum for an individual, twice that for a family. So it's really
Kevin, do you mind
I don't-
explaining what that means? The annual out-of-pocket maximum?
Yeah,
It's
so
just
you're going to pay
in
your
case someone's.
premiums. You're going to pay your premiums every month. You have to do that or coverage goes away. And then after that, you will pay a copay or co-insurance for other coverage, right? So if you go into a doctor's office, you pay a copay for the visit. If you go in for something like a CT scan, you're going to pay something that's maybe copay, more likely co-insurance. So 20% of the cost you're going to end up paying. But with those copays and those co-insurance, they hit a cap. It's the out-of-pocket maximum. So if I have lab tests and CT scans and medicines and visits galore, eventually I'm going to hit my $8,200 out-of-pocket maximum, and then my costs will be covered from there fully by the plan. But the $8,200 for an individual, $16,400 for a family, does not include your monthly premiums. And the monthly premium is going to be in the just generally, then this is really inaccurate, but just generally, bronze is $300, silver is $400, gold is $500, platinum is $600 a month. Totally wrong to say it that way, but in the ballpark.
And can I just share something to think about, at least for me, because when I did this like 5-ish years ago, it was really daunting to figure out which plan I'm supposed to take. I'm relatively young, relatively healthy, and just the way I personally grew up, we didn't grow up with medicine. So needing to be required to have insurance was a whole new thing for me. I don't know if anybody else is out there like this, but I'm just sharing my experience. So somebody explained it in this way for myself when it came to bronze, silver, gold, and platinum. They're like, well, how much do you think you're going to go to the doctor? I'm a person that didn't grow up going to the doctor often. So it was suggested, well, maybe you look into the bronze plan. Again, this is a suggestion, not telling you what to do. I recently had a baby. There is no way I would have gone with the bronze plan.
Exactly.
With having a baby, because I'm going to monthly and then additional pediatrician appointments. When I was pregnant, I was sometimes monthly, sometimes weekly. So then in that sense, I'm going to go to a plan that the premium's a little bit more, but what I'm paying for my out-of-pocket expenses is less. So that's just a way to kind of look at it for yourself to see what really is worth it. When back in the day I didn't have kids, I barely went to the hospital. If I went for like to my OBGYN, which note that there's certain care that there is no copay, and make sure you go and let them know. If you're having a pap smear, you walk in and say, I'm having a pap smear. They say, oh, okay, there's no copay for this. Although you see here that there's some prices for certain things or whatever. That is zero cost. There's certain things that are zero cost for checking in on yourself. And so for me, that's all I needed for that year. And that was it.
Tiffany,
Yeah.
FYI, as a female, there's a lot of things that you do have to pay for that no insurance covers, which is really horrible as a female. Just saying. So
know the few that you don't have to, because they were ready to charge me. That was the thing. I walked in, they were ready to charge me a copay knowing my plan. I said, no, this is what I'm going in for. And then it was zero cost. But thank you, Nina. It's great to know.
I did remove from my reduced chart, I did remove the line that indicates that for covered California plans, wellness visits are $0, meaning your annual physical is $0 to you. But the plan could be picky about that. So if you go to the doctor for a physical and then try to get help there for some other need while you're there, you may have to pay the copay. But I took that out just because it's the same for all covered CA plans. Yeah. And then one thing I would indicate, and this is not in my simplified chart, but in the other chart, the subsidized versions are all various flavors of silver, which indicates that the state's pushing people towards silver, right? And so bronze, it's a little tricky. I mean, if you're not going to go to the doctor at all, my brother Nathan should be on bronze. He never goes to the doctor. But silver is a good fit for a lot of people, and platinum is kind of a bit of a splurge. So I would guess most people watching this are going to end up on silver or gold. And that's just a guess, though. Your mileage may vary.
Great. Thank you for sharing these charts.
I'm going to stop sharing the screen now, but we're going to find a way to share the links to these two things that I shared.
Awesome.
Tiffany, are we going to get into like our doctors and things like that, or um, like if you have your primary care physician and you're looking for insurance and you want to see if they're covered, blah, blah, blah. Are we going to be talking about stuff like that?
Girl, go ahead. Let's get right on into it.
Okay.
Yeah.
All right. Let's get into it.
Yeah.
um, one of the things that I think is scary, and it was scary, I'm gonna speak for myself. One of the things that was scary for me when I started to, when I went from SAG insurance to Covered California was, I had a primary care physician that I really loved, and I wasn't sure if he was going to be covered. So, I had to, this is the part that's tricky, but it's part of sleuthing, and you kind of have to figure out like what do you want covered, what is important to you. And there were certain things that were more important to me, like I get a prescription every month and I wanted that to be a smaller price because I knew, I looked at the economics of it for myself. But the scariest thing I think for me was the doctors. Like, am I going to see my GP? Am I going to see my rheumatologist? Am I going to see, is my, facial, my dermatologist, I tend to have things like that. Is that covered? And, playing with the pros and cons, figuring out the numbers was the thing that I think took the most time for me and was the scariest part to figure out. So as you're looking into these plans, you may want to think about, who your doctors are, if you have a primary care physician, and what insurance do they take, and then proceed from there if it's very important to you. If it's not important to you, here's what's really cool is that you may go for a PPO plan, or you may just go to Kaiser and an HMO. And I know a lot of people who've gone to Kaiser who really love it. It's all in-house, and they fall in love. They have excellent doctors there. So, and that's a smaller price point than a PPO. This is an HMO. So that's something to look at as well. So that's my experience.
Thank you, because, and that actually goes perfectly into a question that I have with how easy or difficult was the process for you. I'll share my experience from back then, and that was a big thing. The numbers, and especially somebody who wasn't so experienced with going into the doctor as often. So it made me not want to sign up, to be honest. I was like, what's the penalty? Give me that instead. Or I was like, but then the fear of what if? You never know, the what if. And I was like, so I decided to actually take the time and look through it. And I did two specific things. One was finding a primary care physician that I liked, and then figuring out what they took from the plan. So did a little bit backwards. And then I also called, and I am the type of person who will call about 3-4 times. I need you to say it to me about 3-4 times so that I understand what the answer you are that's giving me. And I will say that they were very helpful. I actually got the same answer every single time. So I felt as if the people were knowledgeable, and it made me feel more confident with what I was going for. As well, if I was to do Covered California now, I contacted the Actors Fund. Oh gosh, what's the beautiful woman's name? Because they do individual support as well. You can do every artist insured. Kevin, you have her name?
The one person I think I
Kai?
can think of is Kai.
Yeah.
Kai.
Can you explain what every artist insured is, just in case someone is not familiar with that? Do you mind, Tiffany?
Yeah,
Thank you.
sure thing. So, with all of these changes when it comes to healthcare, the Actors Fund has created this, I don't know if I can call it a campaign or a program or whatever, but a resource, I'll say, a resource called Every Artist Insured. And so, twice a month, they offer a webinar where they talk through, for California, Covered California. There was also where they came from like a New York base as well. So it kind of came from that perspective too. But in all, they are giving an overall resources and information when it comes to what to expect and what to do in order to use the marketplace to get yourself healthcare. So this is through the Actors Fund. I will take a moment and look that up to get the link and put it in the chat so that everybody has it as well. And the cool thing that happens is that they have that overall one where you hop into a Zoom like this, they have a presentation, they ask questions, and people are exceedingly knowledgeable. Also, they offer individual support. So you can sign up and get yourself a little one-on-one and talk through what it is that you need and how to sign up, and they will support you with that.
Yeah, and I would add the webinar is like tonight except better, and the individual support is one-on-one, and they're busy this time of year, but it's a very great service, and they don't cater just to people doing covered California. You know, if you're somebody who's doing Medicare, for instance, they could still help you out, but they have a backlog. So if you were to go to their website tonight or tomorrow and request an appointment, they will help you, but it could take 2 to 5 business days before they can get back to you because there's so many people in need of help, especially this time of year.
Right.
So I would say do that immediately and expect to have an appointment with them maybe Thursday or Friday, but probably next week. And then also next week on Tuesday is another webinar that they are presenting. I think it's the final one they're doing before the end of the year. They do them monthly though.
Nina.
So when you speak to this person, what exactly are they doing for you? Are they, what happens in those sessions with your person?
Yeah, they will walk you literally through it. They will literally walk you through it with Covered California and having you sign up. So the same way that we're just coming from our experience and like saying, sign up, here's some tips and tricks and what to do. They're going to take the information that you have and walk you through signing up.
Yeah, and they are licensed and trained health benefit specialists. So it's a whole thing.
Right, right.
That's really awesome that we provide that. That's really great.
Yeah, the Actors Fund is great. The Actors Fund, of course, is looking out for SAG-AFTRA members, but you don't have to be a SAG-AFTRA member. Anybody in entertainment can take advantage of most of their programs.
That's great.
Exactly. We have a question, if one of you all have an answer for it. So Robert asked, do the numbers change if you report your income hourly, monthly, or yearly? Do the numbers change if you report your income hourly, monthly, or yearly? Is that clear? Or we can unmute him if he wants to explain. Oh, go ahead, Nina.
Yeah, I can't remember. I have to actually remember if, you know what, I can't remember if they ask, if it's monthly, if they ask for a monthly or if they ask for a yearly. But again, I'm just going to say what I did. This is my personal experience. The first time I signed up, I took my previous year tax return. I had that, and that was the easiest way to look at the numbers. I didn't look at the year that I was in. I looked at the previous year, and I think I divided it up into 12. I think that's what I did. So, and my gross, not my net, my gross.
Well, and so along with that, and yes, with the gross is important. I was listening to Every Artist Insured. It was a New York rep, and what she said to do was to take 3 months of work from last year and take the average of that. So it takes away from the income hourly, monthly, or yearly, but it was just the average of those 3 months and what you got from that. So I hope that supports your question, Robert. Great. Let me get back into some of these other questions I had for you all. So where have you heard or seen people struggling when it comes to signing up for Covered California? Where have you heard or seen people struggling when it comes up to Covered California? I'm going to give an example for myself, at least what I'm hearing from people. Obviously, with the plan changing, it's heartbreaking and it came out of nowhere. And I think at times it can paralyze us. It can paralyze us. And it's really daunting when you've had your same primary care physician and your same insurance for who knows how long. And now all of a sudden, all of that's changing. Or I have another friend who she has been under the insurance. She just had another baby. So for her, her numbers changed significantly where it's not an affordable option. So that's what I mean for paralyzing. And
Yeah.
I feel like that's where I see a lot of people struggling. And I hope, like, this is the reason why obviously we're here with members helping members to give just some forward movement when it comes to that. And also the idea that the website is really difficult and confusing. And I found that to be the exact opposite when going through it. Yeah, Nina.
Thanks, Tiffany, for saying that. That was awesome. I think what I've observed is that change is hard. And this was a huge change overnight for a lot of people. There was an expectation that was suddenly ripped from under them, under a lot of people, and that's scary. Change is hard. Change is scary. So what I've observed is a lot of that, a lot of fear around having to a lot of fear about where to start. How do I start this process of doing this? I've never done it before. So I'm really I've been trying to, as best as I can, provide people who are in that state of panic with my experience. And it's really great to hear about Actors Fund. Like I didn't know about that, so that's awesome. Like if there's someone actually holding your hand through the process, I think a lot of people need that right now. So that's great. I have held a couple people's hands through the process. Like, let's get on the website together. Let's do this together. But that's what I've observed is it's just fear of change.
Yeah, change is difficult, of course, and health insurance can be complicated because there's, always several dollar amounts kicking around. When I was new to California, I was looking to insure myself, and that was hard. There was no central place to go to. I did end up applying to some health insurance plans that I thought would be a good fit for me, and I was denied coverage. So those things are gone, right? If you go to coveredcalifornia.com, you may not see the plan of your dreams, but you'll find a good plan there and they will cover you. That didn't used to be the case. That's a huge difference. And I ended up switching around, and for a while I was with the Kaiser Permanente family, but as a self-pay person. And then I started getting union coverage through Actors Equity and also through SAG and then through SAG-AFTRA. And I've done a brief calculation. You pay a few $1,000s to join the unions, and if you get to work and qualify for the insurance and have a procedure like I did, then I got $100,000 in benefits from having great health coverage and from having reduced monthly premiums compared to being out on the market on my own, paying a lot of dollars a month more than it is now. So even though it may be daunting, even though it may be hard, even though it may feel expensive, Covered California is a much better thing than searching for health insurance on your own used to be in this state.
And I think, and this is obviously, yeah, just great. And the whole reason as well for this evening is that just what you said, like, we shouldn't be doing this alone, and you don't have to do it alone. There are resources, there are people, there are those who have had experience. And I once again want to big up the Actors Fund because they really do support artists. And we might have some artists that are not union yet, but aspire to be there at one point. Know that the Actors Fund is also there for you too. So you can go and check it out. Yes, us union members use it, but it's also, as long as you have shown, there's a way that they record it to make sure that you are an artist and you've done some sort of artistry, and you can get that same exact support as well. I think that's really important where we support our non-union members because they're going to be union one day as well. So knowing that we're all in this together, I think is really, really important.
I have another tip or trick. I'm sorry, I don't remember the guy's name, but so I'm part of a Facebook group called the Commercial Union Dads Group. That's not the official title, but it's a bunch of men and we share information. There's a man in there whose name escapes me right now, but he does this as well. And he offers it for free to people in need if they're in the actor community. So if you are a dad and you're seeking help and the Actors Fund is all booked up, post there or message me individually on Facebook and I will connect you with that man whose name I forget.
All
But
right,
he's
all right.
he's an individual who does what Kai does what EHIS does. They are licensed individuals who know about the landscape and they can walk you through it.
And as you'll see, I just put into the chat the next Every Artist Insured Getting Affordable Coverage. So the last one that they're doing is on December 15th. I encourage you really try to sign up before December 15th. But again, if this is daunting and you're like, I need some support, I need some help, go ahead onto the Actors Fund, see if you can get a meeting for one-on-one. If you can't even get that, go to this workshop. It's on December 15th, 12 to 1 p.m. PST. Yes, Kevin?
Okay, so I just posted actually a link to EHIS California, and that's the subdivision of the Actors Fund and a joint venture apparently with the MPTF. And that's where you get the one-on-one help. It is through the Actors
great.
Fund. There's a separate link for it. Previously, I also posted a link to their chart plus my reduced version of the chart. We'll find a way to also put these links in like the YouTube comments or something so for people.
That's great. That's great.
EHIS stands for Entertainment Health Insurance Solutions. If you go to their website, you see Kai on the front page there, helping somebody, helping an actor. I know that guy. All
Awesome. Awesome. And Nina, how was the quality of care once you went through with Covered California?
Great. It's just the same quality. It's a subsidy from California. Thank you, California.
Right. Right.
I changed my life dramatically 10 years ago and went on a different journey after being an actor my whole life. I'm still an actress and now throwing my hat in again, which has been so much fun. I missed it. I didn't realize how much I missed it. Anyway, I lost my health insurance. So, it was really great to be able to go through the exchange. The first time, I will be honest, years ago, when Obamacare started, we're going to call it Obamacare, but Covered California, Obamacare. It was very difficult to go through it. But then once I figured out Covered California, that was like our local exchange. It was so much easier. And now it's a breeze. Once you're in the system, it's a breeze. They just ask you some simple questions. And gratefully this year, usually when you have insurance through, obviously, we all know this, it goes up every year. Every year it's like up another $10, another $10. This year they're not doing that. So that's kind of nice.
Yeah, it's so great. They will give you coverage. They will never kick you off the plan. They don't charge
unless you make too much money.
Well, no, you'd lose your subsidy, right? But not the ability to access a plan.
Correct.
And then, because that's this egregious thing you hear about where someone suddenly gets really sick and their insurance company dumps them. That was before the Affordable Care Act. So, the other thing about Covered California compared to how it used to be back when I was on the self-pay market, your rates don't go up because you have a health condition. So it's just
I think it's against the law for people to do that now, like for companies to do that. I don't think they can, like not anymore.
That's California or the Affordable Care Act, but that's the good news. So much good news. I know a lot of people are losing SAG-AFTRA health plan coverage for the first time in a while. This quarter, next quarter, next quarter. Covered California, guys, it's so much better out there than it used to be. I know it's tough, but it's so much better.
It really is.
And I'll be there myself 6 months, but yeah, it's not nearly as crappy. And so but we really, it's daunting because there's so many dollar amounts and so many charts and tables. So.
Yeah. And one of our folks watching, Robert, he wanted to share his experience with Covered California. I would love to hear about it, Robert. So Ellen, can you unmute him or I can? Oh, you were there and then it went back to it. Let's try one more time. One second.
Yeah, Robert, don't touch anything. Let us unmute you.
So this might be a good time for me just to add one little piece of information. Covered California is not your insurance company. So when you go through Covered California, you will end up with insurance through an insurance company, but they are not going to be your insurance company, in case anybody was curious about that. Looks like we have Robert on video and on mic. I'm going to turn off my mic.
Right, Covered California is an exchange. It's like a yellow pages for, all of the insurance companies.
All right, Robert, I'm going to, it says ask to unmute, so we're clicking on that for you. Great. How about now? Are you seeing it? That's very odd. Let me try it again for you.
Can you hear me?
Yeah, there we go.
Hey, happy dance. Guys, thank you so much for hosting this event. I know it's benefiting so many people, and it's benefiting me even though I'm covered by Covered California. And it came at a time where I really needed it about 2 years ago. I'm going to be vulnerable here and be completely honest about trigger warning, for those who have depression and those and that kind of life challenges. But about 2 years ago, I had a breakdown basically, and I had a mental breakdown. And I was ordered by a dear friend to go to the ER because she was worried about my safety. And I, went to the ER and I was held for my 24 hours, which turned into, a week stay, a week unplanned vacation at a facility. And when the bills started coming in, they were expensive. My inpatient bill alone, if I did not have Covered California, would have been over 10 grand. If I did not have Covered California, my bill would have been well over 10 grand. And because I had Covered California, I did not have to pay for my ER bill because it was an involuntary admittance. My ambulance bill was knocked down to, it was almost 3 grand. I only ended up paying about, and it was still a bit of a bite for me, but slightly over 1,000, but it could have been a lot more. And my inpatient was pretty much covered up until 20% of my co-insurance. So I only had 20% of that bill to pay, and I was able to negotiate that down even further. But like I said, and then not only that, afterwards, I was assigned a concierge, like a case manager. My outpatient care was taken care of. Like there was a mental health services that was a part of my plan that, to my surprise, was at no cost. And it's only improved since then. But like I said, if I did not have Covered California, my bill would have been well over $10,000. And so I am very grateful for it. And like, as Kevin said, it's been a rough go since its implementation. It's been, peaks and valleys, but it's definitely has improved. And my bill is actually going down next year after having going up. I'm still on the same plan with Blue Shield of California, and I'm eternally grateful for it. So yeah, I just wanted to share that.
Thank you, Robert. I'm so glad you're with us and doing well.
Thank you so much.
Thank you so much, Robert. Really good to hear you. Thank you.
Yeah.
Do you remember, are you like silver plan?
I am a silver HMO trio, a silver 73 HMO trio with Blue Shield. And what they've done is they created this plan that's got parts of an HMO, parts of a PPO, and blended it together. I'm actually quite happy with my plan and stuck with it this year, even though my bill went up. But like I said, it's going down pretty significantly to next year. So, yeah.
Yo, I so appreciate your vulnerability and just your story within that, because that's really real. That's really, really real. And it's when it you don't know something's gonna happen is when you need the insurance.
Yes.
That's when you needed it. Yeah. Completely.
Yeah, it's funny.
Completely.
Health insurance is so many things at once. You know, there's the self-care we all need, and then there's the emergency, and they're blended together. That's not the way it is with your auto insurance, for instance. That's only about the emergency. That doesn't include tune-ups.
Right. Yes, exactly.
Well, and it's interesting. Oh, sorry. Finish your thought, Kevin.
I just remember we haven't said one thing tonight. I want to make sure we get it out there. Next year, if you don't have health insurance, California is going to charge you $695 on your tax return. So there's been some changes in that with the federal going away and stuff, but that's in place for California.
All right, guys, I'm heading out.
Thank you, Robert, so much.
I'm
I'm glad you're doing well. Thank you for sharing that.
Thank you. Great.
Yeah.
Go ahead, Nina.
Insurance will be required. Thank you for saying that. I think it's important that everybody know that.
Right. And something that I didn't realize, just making my own phone calls, I don't know if this is all insurance, but Robert just made me think the fact that he was an advocate for himself. He had covered California, but then he was an advocate for himself for asking for a way to even lessen those bills. So that's really, really important. And again, I know it can be very paralyzing, and especially in any sort of situation where you are physically or mentally hurt. But remembering to be an advocate for yourself, I think, is so important, because fortunately he was able to lessen his bill. Or just recently, and again, I don't know if this is all insurance plans, but I called my insurance plan about therapists, and come to find out it was completely free for the year of 2020 because of the pandemic. This is something I did not know. So yeah, we got a month left, but take advantage of that. If call your insurance if you have it, or sign up for Covered California. Make sure you got it. And I wouldn't be surprised if that continues for 2021. But just looking into these things a bit more, asking some questions, digging a little bit deeper, and you might end up finding some more gems, even though you thought that you were losing something. So along that line, just as we're starting to close up, and before I go and check and see if we have any other questions or comments, I would love to hear just if you guys have any other tips or tricks that you didn't mention before that you just want to throw out there to the group. Do you guys have anything else? Otherwise, I'll see if we have any other questions or comments. Yeah, Nina.
Dental. We haven't talked about dental. And I pay for dental monthly, and I get two cleanings a year in my plan, free, which is pretty cool, even though I do 4, but there it is. And it saved me a couple times this year. Apparently all of us are grinding our teeth because of COVID. We're all stressed out. And so the dentists have been working overtime this year. Thank God for my dental insurance, because I had to replace 2 crowns. So that was almost 100% covered. So yay.
Did you get a plan through Covered California for dental?
Yes.
But it's a separate choice, right? It's a separate purchase.
Yeah, it's a separate purchase. Mm-hmm.
And you're reminding me, because I did have dental through Covered California, and it was so dirt cheap. It was like I feel like it was
$12.
Something like that. Yeah. Really dirt cheap and you would be covered for your 2 cleanings. And I had a fantastic dentist I was very, very happy with. Yeah. Any other tips or tricks before I check in and see if we have any other questions or comments? Ellen, do we have any other questions or comments that we can share?
I'll just say that John Connolly had said that Marty Ryan at Bright Star is a SAG-AFTRA member who can help you find affordable health insurance. He says that he helped my family a lot. So he says covered California is Obamacare, way better than the open market. He agrees. So, John, did you want to speak to this? Hold on, let me unmute you. Hold on.
Okay. Can you see anything except my thumb?
We can see and hear you, John.
Oh, thank
We can
God.
see and hear you.
I am so inept that I wasn't sure what was going on. Okay. This is such a great meeting and such a great discussion. I just wanted to tell you all how grateful I am that you all are putting this together. It's actually kind of amazing. This is literally members helping members, and it kind of blows me away. It's really cool. I got to say a couple of things very quickly. I'm a senior and a retiree. So my world changed in August when we got the notification that the SAG-AFTRA senior plan was essentially going away and that we would have to adapt to a new plan by searching through various plans and picking the one that was right for us. And we would have a certain subsidy from the SAG-AFTRA health plan. Now, I have more than 25 years as a working actor, so I'm very lucky I got the best deal. Other folks at 20 years and less have a different deal, and it's difficult, and I empathize. I empathize with myself, and I empathize with all of you. But I will tell you that dealing with VIA, which is the organization that the health and retirement plan hired to help the seniors navigate the transition, has been extremely helpful. And I picked a series of plans for healthcare, for dental, and there are three. Oh, pharmaceutical, of course. Yikes. And so far, everything has gone very smoothly. It takes time, it takes concentration, but hell, it's your healthcare. So you got to focus and learn how to do it. Now, I was a trustee of our health and retirement plans for 20 years. So I thought I was like on top of all this stuff. But no, when it comes to my own personal life, it was really a challenge, and I was nervous and confused and scared. It was really hard, and then it became clear. I was so grateful. Now, in terms of what everybody's dealing with who may have to move to covered California, let me tell you, there are great people out there who can help you. And covered California is Obamacare. And in California, we honor Obamacare and are supporting it. And there are great plans out there which are affordable and comprehensive. So I just wanted to tell everybody it's out there. I had to use it when my healthcare changed and my spouse had to go on covered California. It worked very well. Just focus, know what you got to do, and it'll happen. Thanks a lot.
Thank you.
Oh my gosh, John, I'm going to jump in and just say thank you so much for your story and for sharing with us today. I so appreciate it. I'm so glad that you figured it out and found your way and that you're covered and you're going to be okay. Yay.
And I do want to, John, it's great that you added that. And just in case anybody's confused, though, covered California is a great option. But if you qualify for Medicare and you need help in that world, or there's VIA benefits, and the Actors Fund can help as well. But the intent of this seminar was to focus on people that don't qualify for Medicare and that are turning to covered California. It's all complicated, all intertwined. But that's why John is sort of the only one who's talked about it, because we purposefully have concentrated on covered California for those who don't have access to Medicare.
Right. Thank you. And I think, again, just that idea, being an advocate for yourself, getting curious, finding out resources, trying out the resources. We have a former trustee noting like, hey, I had to go do the same exact thing. That, I mean, that's
can I just hop
Doctors are
in,
their own worst
Tiffany?
patients, and trustees are their own worst self-advocates.
I just have to jump in and say this, that I love that you use the word curious, because that is what that is a must in this process. You must become curious. Otherwise, you're just going to stay in fear. And that's, I think, the big thing is become curious, see what's out there, ask questions, stay curious.
Exactly. And when we say these things, it's not to negate any of the emotion that goes behind what has happened, because it is traumatic. This year has been traumatic, okay? But what we're trying to hopefully do is just pull you up. Let's climb this ladder together, because I don't want to lay flat on my back. We're not going to get anything done, right? Ellen, do we have any other questions or comments?
I'm at the moment not seeing, but I'm gonna take another look here, just to make sure.
We can easily wrap it up. It's just a little under an hour.
If anyone wants to speak, they can also raise their hand in the participants. At the moment, I'm not seeing any additional comments or hands.
That's fine. I think we had such a fantastic discussion, and I'm really so thankful for everybody that was here, especially Nina, especially Kevin, hearing your experiences, learning the education that you received. Thank you, thank you, thank you for sharing so much, because this is really going to support and help our members. And like we noted before, there's a bunch of stuff in the chat. So take that screenshot. We're going to post this on YouTube as well, and we'll make sure to get some of those links into the description at the bottom to make sure that you all also have these resources, okay? Stay safe, stay healthy. Thank you for being here. Thank you for those who gave questions and comments, and just continue to, let's blast out of 2020. All right?
Yeah.
Blast off.
Blast off. All right.
And thank you to you, Tiffany, for hosting. Great job.
Thank you.
The TYC for the TLC. All right.
Bye, guys. Take care.
Everybody.